Now, let's get more on the news that 30 hospital trusts across Britain are using a loophole in NHS rules to allow patients to buy drugs privately. Ministers have banned the so-called top-up payments, saying they undermine the principles of the health service. But some patients say they couldn't live without the additional care. Well, Steve Davis is from Healthcare at Home, the UK's leading provider of high-tech home healthcare and speciality pharmacy services. Thanks very much for coming in.
You're welcome.
What's your reaction to this? Were you aware that people were doing this at 30 hospital trusts across the UK?
Yes, we were. To give you the background, Healthcare at Home provide treatment for patients in the comfort of their own home across a variety of therapy areas.
Including cancer? Including
cancer, yes. And whilst in total we probably treat in the region of about 100,000 patients each year in their own homes, I would say that at the moment the number of patients who pay for their own cancer treatments is probably in the region of about 1,000 patients each year, coming from around 30 of the NHS trusts.
So just to be clear, your organisation provides top-up care for patients who are undergoing NHS treatment?
Yes, we do.
As part of what you do?
Yes, we do. To explain how that works, everything that we do is under the strict direction of a referring specialist. So a patient cannot approach us directly, they have to be referred by their specialist. Yes.
So what do you think about this though? Do you think that people who are having NHS treatment and are then referred to you guys as well, do you think that undermines the principles of the NHS?
I appreciate that it's a very difficult decision for the NHS. Resources are finite and there is only so much money to go around. We are all about providing care for patients wherever we possibly can, and we do that in an extremely cost-effective way. The vast majority of the work that we do is actually on behalf of the NHS, because treating appropriate patients at home can save significant amounts of money versus
But the problem with this, I guess, is that doctors are interpreting the rules, aren't they? They're interpreting what is meant by an episode of treatment, which does lead to a two-tier system, doesn't it? Because if you happen to be lucky enough to have a doctor who interprets the rules in your favour, then that's great, and then you'll have access to further medication. But if not, if you don't live in one of the 30 hospital trust areas, then you're not going to have the same advantages, are you?
That's right, and that's why we welcome the fact that the government are going to provide clarification on this very issue sometime this month when Professor Mike Richards reports back to the government. And obviously, in a perfect world, we would like to see these particular treatments available to every patient on the NHS. And I heard Professor Nick James from Birmingham this morning talking about the fact that wouldn't it be great if the NHS could realise some efficiency savings in order to do that. There has been some work published recently that has shown that, you know, if appropriate patients are treated at home, then that can actually save the NHS considerable sums of money. And perhaps in future, that might be a route to actually making these drugs more widely available.
OK. Thanks very much indeed for coming to talk to
welcome.
us about it. Thank you.